Hello everyone, welcome to a day in the life of a medical student. So as you can see, we reluctantly begin our day at about 6:30 a.m. when I finally crawl out of bed and do some morning stretches apparently. After that, I hop into the shower and just wash, brush my teeth, clean my face, and just generally try and get ready for the day. And then I pour myself a cup of tea, have my breakfast, and then get dressed into my clinical clothes. After that, I decided to watch a video on how to do an abdominal exam to remind myself, because I had a sneaky suspicion that I'd be doing one today, and to do this I use Geeky Medics, which I really recommend. Welcome back to another Medical Projects YouTube video. If you haven't already, please do make sure you subscribe and like this video. Comment down below and follow us on all of our social media links. They'll be in the description box. This channel is a super awesome resource for any prospective medical students to allow you an insight into what medical school is truly like. And also we offer tons of application tips and tricks to ensure that you get your dream place at medical school. So if you like the sound of that, make sure you join the family. I'm so excited to be having you follow me along on my hospital placement day today so that you can see what a day in the life of a medical student is like when you're on clinical placement. I'm on a ward today, which I don't feel very confident about the material. I don't have a whole lot of knowledge on this area of medicine, but today you will be following me onto a colorectal ward, and that's basically a ward that deals with diseases of the bowel. So things like IBD, Crohn's, diverticulitis, different malignancies of the colon, things like that. So it should be really interesting. I have no idea what we have in store for me today, so it will be just as much of a surprise for you as it is for me, but all I know is that I need to be meeting the colorectal team at 9 o'clock, so I best get on with it. To placement, I take with me a notebook, clinical handbook, water bottle, glasses, stethoscope, ID badge, pen torch, normal pen, and a pair of trainers. I can be your third man doll, just a symptom you've forgotten. You slip me in your pocket, turn on. The commute to my hospital takes around 45 minutes, and I have to get the overground and the underground. Don't you hear me out? You're painting all my features and everything you needed. Don't put me on the shelf, no. Since I'm on the colorectal ward, let's have a brief anatomy overview of the large intestine. CT scans are a really useful diagnostic tool when you're looking for bowel obstructions, and is something I use today that I'll tell you more about later on in the video. Taking patients' blood samples is another really useful diagnostic tool to look for signs of infection and inflammation. So in the case of a large bowel obstruction, you might see raised CRP levels, which is a sign of inflammation. Often the best way of relieving symptoms of a bowel obstruction is through surgical means. Having such a good day, I can't wait to tell you guys all about it. In the afternoon, I attended a diabetes workshop where we learnt how to take a capillary blood glucose sample, which involves using a lancet or a little needle pen, such as in this video, taking a prick from your finger so you can get a drop of blood, and then putting it in a machine that reads your blood glucose levels. Before commuting home, I grabbed a snack and a much needed coffee. So it is now much later, it is around 5 o'clock, and I've just got back from the hospital, but whilst it's still fresh in my mind, I thought I'd talk about the day I've had today and debrief about what I've seen and what I did. Wow, it was quite a big day actually. I had quite a few firsts for me. I saw some really lovely patients and I worked with some really lovely doctors, so I'm really grateful for that, and I feel like I've learned an awful lot today. I thought it'd be quite nice to talk about what I saw, because for obvious reasons I can't film in the hospital as much as I would like to, so this is the best I can do. Obviously, it's also worth pointing out that I will be changing patient details and any specific identifiable information to make sure that patient confidentiality is maintained at all times. Okay, so I started the day, I turned up to ward round with the colorectal team and they weren't there. This is something that happens quite a lot on placements. Sometimes, you know, they just forget that you're coming, or they're on a different ward, or you don't get the memo. You know, there's 500 of us and trying to organise us all on the wards, I appreciate, is very difficult. A lot of the time as a medical student, you can definitely feel like you're in the way. I'm trying to kind of get used to, and I'm trying to improve my skills of just like putting myself out there and taking any opportunities available to me. So I'm really proud of myself and my clinical partner, because we basically just wandered onto a completely different ward and was like, hey, is there anything we can see? I basically ended up splitting up from him and was with a 5th year medical student and a registrar, which was awesome, and I learned so much. So I ended up seeing a patient who had a bowel obstruction. So I looked at their CT scan before I saw the patient, just so that I could understand clinically what was going on a bit more. Because I'm not really experienced with doing clinical examinations and identifying abnormalities, I find it a lot easier to kind of have a clinical picture before I even see the patient. So wherever possible, I'll ask a doctor or whoever's in charge of this patient what is going on. So on their CT scan, I could see a bowel obstruction around their splenic flexure, and it was presenting as really dilated bowel loops, because if you can imagine, if you've got a balloon and you squeeze it, that's the obstruction. You're going to get loads of pressure building up here, and then nothing's going to be able to flow out the other end. It looked pretty nasty, but obviously from the CT scan you can't tell if this is a malignancy or what is causing that obstruction. It could be a multitude of different things. So I ended up taking a history from this patient, and they were obviously in quite a lot of discomfort. In general, bowel obstructions tend to present as kind of like pain in your abdominal region, constipation. If it's a malignancy, there might be a loss of weight or extreme fatigue. Blood in your stool is also a really big one. So I could really sympathize with this patient, because it is a very painful thing to be going through. So when I did the abdominal examination, I noticed that there was a lot of tenderness when I pressed in the left upper quadrant just here, and that was obviously because there was an obstruction just there, and also the right side of his abdomen was much fuller, and that will be just full with feces. So the next thing I was asked to do, I was super nervous about, but I thought I have to do it now because I'll just never do it if I don't do it. So I was asked to take blood from this patient. So this patient needed bloods taking because they were actually planning to have a surgery the following day to remove this obstruction. But before you do a surgery, it's really important to assess what blood type they are in case they need a transfusion. So I've never taken blood from a real patient before. I've actually only ever done it once on a mannequin. So I was feeling pretty underconfident, but luckily it all went really well, and the patient was super lovely and cooperative, and yeah, I couldn't ask for a better first taking blood experience, so I was super happy about that. And then for the rest of the day, I basically just followed up with this patient, and then I spoke to the doctor and had a debrief at the end. As part of our learning, we have portfolios we have to fill out, and something that I needed to do in order to fill out my portfolio was have a case-based discussion with a doctor about a patient. So this is basically where you discuss the condition, discuss any findings you find in your clinical examination, discuss the management, follow-up, and basically just how you would treat this patient from start to finish. And obviously I have very limited knowledge on this, but by talking to the doctor, I was able to learn a bit more about how we might manage bowel obstructions, and that was really useful. For the rest of the day, I think I'm going to chill out for a bit, and then I'm going to write up my case-based discussion and do a little bit more research about large bowel obstructions, because that's what I saw today, and so I think I might as well take the opportunity to delve into it a bit more and explore how it manifests, and yeah. So as for the rest of the evening, like I said, I just did some further research on bowel obstructions, and then I pretty much just went to bed and chilled for the rest of the evening. So please let me know if you'd like to see more of these, and we'll see you soon.